Finally, I would like to point to WHO's three flagship projects, which are collectively aiming to improve the capacity of countries in the Africa region to prepare, detect, and respond to public health emergencies. In particular, the TAS, which is Transforming Africa Surveillance System project, is a driving force for genomic surveillance. As we explore ways to improve and scale up genomic surveillance, we should note some of the current challenges and priorities around training, around human resources, bioinformatics capacity, laboratory equipment, reagents, data sharing, and monitoring and evaluation. Once again, I would like to acknowledge and appraise the collaboration with Africa CDC and our partners and urge to continue such integrated approach. I would like to thank Africa CDC, Africa Pathogen Genomics Initiatives, and all the organizers of this event for this great opportunity. On behalf of the Regional Director for Emergency Preparedness and Response at WHO, I wish you all a very productive workshop. Thank you very much.
Thank you very much, Dr. Kowa. It is certainly a pleasure for me now to actually ask Ms. Masiri Keto, who is the Director of Programs at the African Society for Laboratory Medicine, to give her remarks. Thank you very much.
Thank you very much. We are more than pleased to participate in this milestone event, celebrating 100,000 SARS-CoV-2 genomes sequenced in Africa. The African Society for Laboratory Medicine has, for the past 11 years, been spearheading advancements in laboratory science in Africa by Africans. We were honored to join the Africa CDC in the implementation of next-generation sequencing across the continent. One of the things that Africa has done right since the beginning of the pandemic was to adopt a regional collaborative approach to optimize COVID diagnostics and surveillance. Instead of countries acting individually, the African member states worked together and pooled resources to boost one another's capacity. With the Africa Pathogen Genomic Initiative, the approach was the same. We pooled the resources and identified 11+ sites across the continent to act as regional centers of excellence. We worked together to procure equipment and supplies, to improve the infrastructure of the sites, and are supporting advanced training, establishment of sample referral systems, and implementing quality management systems. Another lesson learned was that when resources are available, Africa has the learning agility and willingness to conduct advanced science. The 100,000 genomes sequenced to date are proof of this. Finally, all of this could not have been achieved so quickly and effectively without partnerships. We thank our funders and our technical partners for their support and confidence. As the old African proverb goes, to go quickly, go alone, to go far, go together. In this particular case, we went far and quickly together. We look forward to the next 100,000 genome sequence, to supporting national capacity in addition to regional capacity, and to advancing genomics in other critical disease areas. The best is yet to come for Africa as we continue to collaborate, share resources, and expand partnerships towards excellence in science. Thank you very much and enjoy the conference.
Thank you very much, Siri. And certainly it's a pleasure for me to now actually call on Dr. Henu Kubede, who is the head of the Division of Laboratory Systems and Networks at the Africa CDC. And it is also within his division that the Institute for Pathogen Genomics runs. And so, sir, I now hand over the mic to you. Thank you.
Thank you. Thank you, Professor Allen. Let me start by recognizing the previous speakers and also, distinguished panelists, all participants. As you know, despite the important role of pathogen genomics in disease surveillance and outbreak response, it has not been widely implemented in the African continent due to a number of reasons, as you know. Especially cost of sequencing equipment and reagent, infrastructural limitations, lack of skilled human resource, And generally, lack of attention to the field were important factors. However, COVID changed this situation where the demand for sequencing increased significantly. So the Africa CDC work on pathogen genomics dates back to 2018, 2019, when we started with the situational analysis of the continent in terms of capability. And we also conducted a big consultative meeting at African Union here to understand really what the major challenges were, and then the outcome of the assessment and the consultative meeting was used to formulate the pathogen genomics initiative, which the acting director alluded that it was launched in 2020. So let me take this opportunity and thank really a special role of Bill and Melinda Gates Foundation for working with Africa CDC from the very beginning and formulating this initiative. And of course, later other important partners joined the initiative, USCDC, and especially the role of manufacturing companies. Their generous support allowed us to really support this initiative. And ASLM has been an implementing partner, a strategy partner with Africa CDC. And we were fortunate to get the support from our specialized centers, some of who are really the panelists in this session, and also sequencing laboratories and reference labs across the continent. Of course, there are many actors: WHO, the World, the West African Health Organization, and many other partners like Rockefeller Foundation were very much supportive of this initiative. So because of this support, as you heard, today we are celebrating an important milestone for the continent, sharing more than 100,000 sequences. This may seem a small number compared to the other parts of the world, but it's an important achievement for Africa if we see where we were. So this is really an important event that we need to celebrate. And I think all of you here, you deserve a special recognition for this milestone. This event is organized to celebrate this and to learn, to reflect, what were the challenges, learn lessons, and also chart, the next steps. So the next milestone for the African continent and for all of us here will be really, can we sustain the gains that we have made so far and apply pathogen genomics routinely to disease surveillance for other priority diseases in addition to COVID-19? I think that will be an important question that we need to address here as experts, as teams, and as leaders. So to do that, I think we need to embark on important strategies globally, continental level, and also at national level. So we need to engage globally important actors to do a cost reduction so that pathogen genomics will be democratized. And then we need to advocate simplification of the technology so that sequencing can be possible with minimal laboratory infrastructure and training requirements. And we also need to address some regulatory and policy bottlenecks. And it's also important to focus on establishing core genomic sequencing facility instead of focusing on silo disease-specific sequencing programs to gain cost efficiency. And also, we need to promote a networking approach so that countries share public health assets, because we know all countries are not at the same level. And then, it is important also, to engage member states so that we can have a pathogen genomics strategy in each member state as part of their national health plan to address, sustainability long term. And finally, we need to do more in terms of utilization of pathogen genomics data at Ministry of Health so that we are adding value to the disease control program. So this event today, the virtual meeting, will address some of this. I'm really excited to see a very strong lineup of panels. We look forward really to listen to the panelists in some of these areas that I mentioned in additional program areas. So we look forward for a very interactive session, and we are really ready to take further any of the recommendations that are coming out from this session. So once again, welcome to this important session. I thank you for the opportunity. Back to you, Professor Alan.
Thank you very much. And what you've now heard from are four remarks from our